Turmeric, often praised as a powerful natural remedy, is celebrated for its anti-inflammatory and antioxidant properties. But just because something is natural doesn't mean it's safe for everyone. Did you know that turmeric could potentially cause harm if you have certain health conditions? In this video, we'll uncover the surprising risks associated with turmeric if you have any of these 10 specific health issues. Before you sprinkle more of that golden spice into your diet, watch this video to ensure it's safe for you. Title: Avoid turmeric if you have these 10 health problems. Introduction. Turmeric, often praised as a powerful natural remedy, is celebrated for its anti-inflammatory and antioxidant properties. But just because something is natural doesn't mean it's safe for everyone. Did you know that turmeric could potentially cause harm if you have certain health conditions? In this video, we'll uncover the surprising risks associated with turmeric if you have any of these 10 specific health issues. Before you sprinkle more of that golden spice into your diet, watch this video to ensure it's safe for you. 1. Gallbladder problems. Lisa had always relied on home remedies to manage her health, but when she started experiencing mild stomach discomfort, she decided to up her turmeric intake. Little did she know, her turmeric habit was making her gallbladder issues worse. If you suffer from gallstones or other gallbladder conditions, turmeric might not be your friend. This golden spice stimulates the gallbladder to produce bile, which can aggravate existing problems. While it's known to aid digestion for many, for those with gallbladder issues, it can lead to sharp pains and serious discomfort. The increased bile production may even trigger severe complications if not monitored. For someone like Lisa, what seemed like a harmless choice actually worsened her condition. It's important to consult a healthcare provider before assuming turmeric is beneficial, especially if you have any underlying gallbladder issues. Taking a natural supplement without professional advice can sometimes do more harm than good. Bleeding disorders. During a routine checkup, John's doctor noticed his blood clotting time was longer than usual. John had been consuming turmeric daily, thinking it would keep him healthy. But it turns out, it was working against him. Turmeric has blood-thinning properties that can be dangerous if you have a bleeding disorder or are on blood-thinning medication. The active compound, curcumin, can prevent blood from clotting as it normally would, increasing the risk of bleeding. Even minor cuts or bruises could become more serious, and surgical procedures may pose added risks. It's easy to overlook how powerful natural supplements can be. In John's case, his well-intentioned habit could have led to a medical emergency. If you're dealing with any type of bleeding condition, speak with your doctor before adding turmeric to your routine. 3. Diabetes. Alice thought she was doing her body a favor by taking turmeric supplements for its anti-inflammatory benefits. But as a diabetic, her blood sugar levels began to fluctuate unpredictably, leading her to reconsider her turmeric intake. Turmeric is known for its ability to lower blood sugar levels, which may seem beneficial for those managing diabetes. However, if you're already taking medication to control your blood sugar, adding turmeric could lead to hypoglycemia, dangerously low blood sugar level. The combined effect can result in dizziness, fainting, or even more severe complications. For people like Alice, monitoring blood sugar is crucial, and introducing something as potent as turmeric into the mix requires careful consideration. Always discuss with your healthcare provider before combining turmeric with your diabetic medications to avoid potentially harmful side effects. 4. Acid reflux and stomach issues. Mark loved adding turmeric to his smoothies every morning, but after weeks of doing so, his acid reflux worsened, leaving him uncomfortable and regretting his healthy habit. While turmeric is generally good for digestion, it can irritate the stomach lining if you have acid reflux, GERD, or other stomach issues. Its spicy, bitter nature can trigger more acid production, leading to heartburn and discomfort. Some people also experience nausea or indigestion, turning what's meant to be a beneficial spice into a source of pain. Mark's experience is a reminder that even health trends need to be tailored to individual conditions. If you suffer from acid reflux or other digestive problems, you may need to limit or avoid turmeric to prevent exacerbating your symptom. Number 5. Iron deficiency. Karen was anemic and always looking for ways to boost her iron levels. She didn't realize that her turmeric supplements were hindering her progress until a blood test revealed her iron levels were still low, despite her effort. Turmeric can inhibit iron absorption, which is problematic for those who are already iron deficient or anemic. The curcumin in turmeric binds to iron, reducing the amount your body can absorb. Over time, this can lead to worsening symptoms like fatigue, weakness, and pale skin, making it harder to correct iron deficiency. If you're struggling with low iron levels like Karen, taking turmeric might be counterproductive. It's crucial to evaluate all supplements and dietary habits to ensure they support, rather than hinder your health goals. 6. Kidney stones. Rick had a history of kidney stones but continued to take turmeric daily because he believed in its overall health benefit. He soon found himself back in the emergency room with another painful stone. Turmeric is high in oxalates, which can contribute to the formation of kidney stones, especially in those prone to them. Oxalates bind with calcium in the kidneys, creating hard deposits that are difficult and painful to pass. For individuals with a history of kidney stones, turmeric can make matters worse rather than better. Rick's experience highlights the importance of understanding how even natural remedies can impact specific health conditions. If you have a history of kidney stones, it's best to avoid or severely limit turmeric intake to prevent aggravating the issue. Number 7. Hormone-sensitive conditions. Emma took turmeric daily to help with inflammation, but didn't realize it might be affecting her hormone-sensitive condition until her symptoms started to flare up. Turmeric contains phytoestrogen, compounds that can mimic estrogen in the body. For those with hormone-sensitive conditions like breast cancer, uterine fibroids, or endometriosis, this can be a concern. The estrogen-like effects can potentially worsen symptoms or interfere with treatments designed to manage these conditions. For someone like Emma, turmeric's benefits might be outweighed by the risks if it impacts her hormone levels. It's always advisable to consult a healthcare provider if you have a hormone-sensitive condition or are considering turmeric as a supplement. Rate, surgery recovery. Brian had surgery scheduled and was taking turmeric to boost his recovery. However, his surgeon advised him to stop immediately due to the potential complications it could cause. Turmeric's blood-thinning properties can be dangerous during and after surgery. The increased risk of bleeding can lead to complications like excessive blood loss, delayed healing, or infections. Even small doses can interfere with the body's natural healing process, making recovery longer and more challenging. If you're preparing for surgery like Brian, discontinuing turmeric at least 2 weeks before your procedure is crucial. Always follow medical advice regarding any supplements during surgical recovery. 9. Autoimmune diseases. Maria had been using turmeric for its anti-inflammatory properties, hoping it would help manage her autoimmune condition. Instead, her symptoms seemed to get worse, leaving her puzzled. Turmeric can stimulate the immune system, which is problematic for those with autoimmune diseases like lupus, rheumatoid arthritis, or multiple sclerosis. By boosting immune activity, it can trigger flare-ups, making symptoms more severe. Although turmeric is often recommended for inflammation, it can be a double-edged sword for those with autoimmune conditions. In Maria's case, what works for one person may be harmful to another. Understanding your unique health needs is essential before adding turmeric to your regimen, especially if you have an autoimmune disorder. 10. Pregnancy and breastfeeding. Jessica was excited about the health benefits of turmeric and began incorporating it into her daily routine during pregnancy. However, her doctor advised her to cut back immediately. Turmeric, when taken in medicinal amounts, can stimulate the uterus, potentially leading to complications like premature contractions or miscarriage. While small amounts in food are generally considered safe, taking turmeric supplements during pregnancy or while breastfeeding can pose risks to both the mother and baby. For expectant mothers like Jessica, being cautious with turmeric intake is key. Always prioritize medical advice over general health tips when it comes to pregnancy and breastfeeding. While turmeric is celebrated as a natural powerhouse, it's not suitable for everyone, especially if you have certain health conditions. Always do your research and consult with a healthcare provider before making it a regular part of your routine. Remember, What works for one person can be harmful to another. So stay informed and take care of your health wisely.